An estimated 1 in every 5 teenage girls between the age of 15 and 19 are either pregnant or already given birth in Kenya. The global pandemic has further exacerbated this problem. Parents, teachers, government agencies, religious institutions, and NGOs have been trying to adequately respond, but teenage pregnancies persist. Now, with the International Day of the Girl Child being celebrated tomorrow, we discuss why the issue of children becoming mothers needs to be addressed now, and the implications of not acting in time. My guests are Dr. Ademola Olajide, the United Nations Population Fund, or UNFPA representative for Kenya, and Jedida Maina, the Executive Director for Trust for Indigenous Culture and Health, or TICA. Thank you both for joining me. Of course, we'll delve a bit deeper into this issue, but I want to get both your initial reactions to that heart-wrenching report on the teenage pregnancies, hitting especially youth and teens who are in low-income, disadvantaged backgrounds. But what's your take on what's going on right now? I'll start with you, Jedida.
Thank you so much, Victoria. I think what we are seeing is as a result of several failures in our community. I think we have failed to provide adequate comprehensive sexuality education to girls. We have failed to provide services when they've needed them. We've failed to provide safe adults that they can go to. And we've simply just failed to be there when they've needed us. And therefore, we are finding that children are having children. It's a really sad state of affairs, especially because sometimes it curtails their whole future. And then they end up in this vicious cycle of poverty.
Right. And Dr. Olajide, Jedida has pointed out some of the existing gaps that would see many of these teen pregnancies happen. But, what's your take on some of the things that are fueling these circumstances?
Thank you, Victoria. I think for me, we need to start at the very basics. When we have large populations of teenagers getting pregnant, two conditions are being fulfilled. One, they're having sexual intercourse. Second, that sexual intercourse is unprotected. So all of the factors we have to talk about, all of the interventions we have to put in place must be such that it addresses those two basic issues of why the age of sexual debut is going low into the teenage years and why the intercourse is unprotected. This will create, if we do not address it, a situation, as my colleague had said, it compounds poverty, but robs us as an entire society of benefiting from the potential of these young girls in contributing. What we have to do, which remains a challenge, is for us to confront the evidence, have the difficult conversations, and take the difficult decisions necessary to ensure we take away those two fundamental conditions. Delay the age of sexual debut, and if it must happen, ensure it is protected.
Right. And Jedida, let me bring you in, because how do we do that in a practical sense? Dr. Olajide talked about early sexual debut and that age getting lower and lower. When listening to one of the community workers in the story saying the one-on-one sessions is not enough. So what more needs to be done to actually reach these girls?
I think the government needs to take it up. I think the reason that the community health worker said that the one-on-one is not enough is because it is disjointed, it is not coordinated, it is mostly individual volunteers, and therefore not all girls are being reached. So the ones that are falling in the cracks are the ones who no one has reached. It is my belief that with enough information, girls are able to delay sexual debut, and when they do have sex, it is often protected, and therefore they keep themselves safe from unwanted pregnancies, but also, most importantly, STIs and HIV.
And Dr. Olajide, where have we gone wrong in terms of instituting some of the preventative measures, things like contraception? We just talked about, maybe talking and trying to guide these young ladies, but preventative measures that are effective, that actually see fewer and fewer girls going to hospital presenting pregnant. What do those actually look like?
Is to ensure that information, skills and services can reach the girls in large numbers. And so it therefore means that we must be able to equip them with life skills within the schools for them to be able to take informed decisions that further their future and protect them. We haven't done that. Secondly, we have to be able to remove barriers that hinder them from accessing services if they do need those services. The DHS in 2014 revealed that about 18% of adult women who need family planning and who are sexually active do not get access. For teenagers, adolescents, it's about 23%, it's a lot higher. So we must be able to move away from sentiments, move away from emotions, deal with the evidence, and take steps that are driven by evidence with the best interest of the girls at heart.
Move away from sentiments and deal with the evidence on the ground.